My name is Dr. Meir Kryger. I'm a professor of medicine at Yale, and I've been involved with sleep medicine for like 1,000 years. And I've always loved working on principles in practice since 1985.
Hi, my name is Thomas Roth. I'm the director of the Sleep Disorders and Research Center at the Henry Ford Hospital. I also have an affiliation with Wayne State University College of Medicine, Department of Internal Medicine, and the University of Michigan Department of Psychiatry.
Hi, everyone. My name is Cathy Goldstein. I am a physician and associate professor of neurology at the University of Michigan.
The newest edition is going to have a bunch of new things. There are several sections that have new section editors with new chapters. For example, the genetics of sleep has a new section editor. Physiology in sleep is new. Chronobiology is new, and so we have a very large number of new sections. Now, one of the ones I'm very proud of is one in which we have several chapters that look at the transition of sleep medicine from pediatrics into adult medicine. This is a problem that many of us are not facing, but something that we all have to deal with. The patient who's first treated for a sleep disorder by a pediatrician turns 18 or 21 and now needs to be followed in a different clinic. So we have several chapters that deal with that issue. And of course, in many of the chapters, we actually talk about COVID, because COVID has had a great impact on our healthcare system and also on sleep medicine.
The first thing which is the most obvious thing is this will be 2 volumes. While previously it was 1 volume, this is now 2 volumes. And in creating this, Dr. Kryger, what we decided, what our goal was to do 2 things. One, to broaden the scope of sleep medicine, and so, and 2, to update it. So not only did we want to, simply find new areas, but we wanted to say all the chapters which you've read in the past editions have now been updated. We're not simply putting those back in there. And we had a couple of different strategies in that. So for example, things like wearables, which was not a big issue before. There was actigraphy but the section on wearables now is a much bigger section because it now impacts lots of people. I mean, even if you have no particular interest in wearables, you're going to wind up with a patient who walks in and said, my Acta watch or whatever, it tells me this and that. So you got to know what they're talking about. And the wearables aren't simply Acta watches. They're things you put on a wall, they're things you put on your mattress. And what do you do with that information? As a clinician, how do you interpret it? What do you deal with it? So wearables is one thing. We also put in a whole section on occupational medicine, which we didn't have before. Occupational medicine is a very big deal, as varied as things like pilots, but there's a whole field now of sports medicine where people deal with issues like traveling across time zones to play sports, and increasingly driving international to do that. So again, we try to, pick new areas and revitalize old areas. New areas. For example, we worked very hard to get last minute a chapter in there on COVID, which clearly was a new area. Also, sections now are more dedicated. So we have sections for the elderly, we have sections for the young. We typically stayed away from young because of other textbooks, but clearly to have a total balance, we now have a section on sleep disorders in the elderly, in young people, and we have a section on sleep disorders in the elderly. So we have more chapters, we have new sections, we have new section editors, we have new and younger authors.
So, what is new in Principles and Practice of Sleep Medicine for the 7th edition? So, as usual, we still have all that great content, including beautiful, really informative figures and videos that can really help people master concepts, as well as question and answer sections to assess your own knowledge. But there are a few new additions that I think are just great. So we underwent a bit of a structural change so that the Principles and Practice of Sleep Medicine could harmonize with the categorizations in the International Classification of Sleep Disorders 3rd edition. So for example, we had the central disorders of hypersomnolence, so narcolepsy, idiopathic hypersomnia. Those were in our neurological disorders section in the last edition, and now they have their own section as they deserve, which I think is great. We also have a completely brand new topic that has its own section, and that is the transition of care of sleep disorders from the pediatric world to the adult world. And that includes a really wonderful, informative chapter on the sleep challenges that are faced by individuals who are intersex or transgender. So a lot of new and really helpful information there that can help us with our practice. And of course, we did add a chapter about how sleep impacted COVID-19 and COVID-19 impacted sleep. And I'm sure that will continue to evolve over the years.
The hot topics in sleep medicine are one, genetics. And in fact, the first Nobel Prize related to sleep in 2017 was for the clock genes that regulate our circadian rhythm, as well as the circadian rhythm of almost all life forms. And that has been a tremendously important area, and we have quite a large section in the textbook on the genetics of sleep. The other very hot topic right now is sleep medicine in the elderly. As the population ages, we need to know a lot more about sleep in older people, and that's an area which we need to know about. So those are a couple of the hot topics, and of course, heart failure. Treating the sleep disorders and heart failure, that is like a super hot area with a lot of controversy, and that is brought up in several chapters. Also, the whole notion of phenotyping and deep phenotyping of patients with sleep apnea is also a topic which is hot, which is covered in a great deal of detail in the textbook.
In the area of sleep apnea is not simply, how do you diagnose it, but now there are phenotypes. What are the different kinds of apnea? That's a very hot topic. What are the different phenotypes? As we get more involved in precision medicine, we want to know not simply what your diagnosis is, but what subtypes you have. The same thing is true in insomnia, where we have sections on phenotypes with insomnia. So there's short sleep phenotypes. So the hot area is precision medicine, and how do you diagnose that? How do you categorize it? And how do you treat different subtypes rather than, in other words, once you had CPAP, it didn't make a difference what subtype you were. You just kept the airway open. We now have subtypes, so now we have to look at how do you identify those subtypes? How do you treat those different subtypes differentially? I think that's a very hot area. Precision medicine is a very hot area.
So I'm really excited about artificial intelligence in sleep medicine, and not just for the automation of polysomnogram scoring, but really deepening the information we can extract from a PSG and what we can understand about our patients and about sleep from the PSG. So helping us really understand the mechanisms, presentation, consequences, and treatment options for sleep disorder breathing, for example. That's something that we can have a much more comprehensive understanding of than we do now with the models artificial intelligence can provide us with. Another hot topic in sleep medicine is really thinking about and furthering how are we going to use longitudinally acquired patient-generated data, so data from wearables, self-report, input mobily into apps, etc. How are we going to incorporate that to improve precision evaluation and management of sleep disorders? That is something that is definitely going to grow leaps and bounds over the next few years, I hope, and we can really provide great patient-specific care and really inform the public on a more precise level what they really need to change or improve about their sleep.
Well, my advice to medical students is go into sleep medicine, but first of all, make your sleep a priority during your training. Because unless you're wide awake and alert, you're not going to learn a whole lot. And in order to be a better doctor, you need to prioritize your sleep, and you need to be wide awake and alert. And maybe with all that, you might actually find a career in sleep medicine as well.
My advice to medical students is that sleep medicine is a very exciting and dynamic area. As meetings are increasingly virtual, attending some of these meetings might be very valuable to sort of figure out where they want to be. Today, so when I went up, when I sort of went to my first sleep meeting in 1970, there was one session. Today there's 42 different sessions. So my advice is to sort of taste them all, figure out what you want to do, and do the things which intellectually challenge you and will motivate you to sort of follow the literature, at the minimum, treat patients maximally, and then do research if that opportunity arises.
So I would say, focus on the areas you love, not the areas that you think you should be doing. Every one of you has unique gifts and characteristics, and the world is best served by you incorporating that into your care of patients or your development of a scientific track. So stay sincere and true to who you are, and just use that to benefit your career. Thanks.